Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Aberrant renal artery. An aberrant renal artery, actually the main origin of the aberrant renal artery is it originates from the vessels other than the aorta or the main renal artery. It can originate from any of the other vessels. So this aberrant renal artery is a unilateral condition which is seen more commonly on the left side. And here this aberrant renal artery is actually involving the lower pole of the kidney. It is most commonly seen on the left side and it is involving the lower pole of the kidney. Now, because there is aberrant renal arteries, these can compress the ureter by extrinsic compression. Like for example, if this is the kidney and these aberrant renal arteries will be present like this and they obstruct the kidney ureter, thus resulting in hydronephrosis can occur, and due to external compression they will result in external compression and finally resulting in hydronephrosis. These aberrant renal arteries are actually the end arteries, and because they are end arteries, if there is any injury to them, this injury or division will lead to the lower pole infarction. Why? Because these aberrant renal arteries will, if they supply they mostly involve the lower pole. So if the lower pole is involved, obviously if there is any blockade or injury to this artery, so this lower pole will undergo infarction. So, renal arteries, any type of renal arteries, not just the aberrant arteries, renal arteries are end arteries. So, as a result, division of them will result in infarction. But if you see renal veins, but if you see the renal veins, in renal veins actually have a collaterals, extensive collaterals. If there is aberrant renal vein, it can be divided also. But if it is an aberrant renal artery, we should not divide it, we should not injure it, we should not do anything which makes it blocked, because the part of the kidney which it is supplying will get blocked, will not get the blood supply, thus resulting in infarction of that part of kidney which is supplied by aberrant renal artery. Now,
thank you and thank you for watching.